My name is Dr. Jeremy McAnulty from New South Wales Health, and I'm here with a COVID update for New South Wales for Tuesday the 16th of November 2021. There were 212 new cases of COVID reported in New South Wales in the 24 hours to 8 o'clock last night. In the same period, there were more than 67,000 tests reported in New South Wales. In terms of vaccination, 94.2% of people aged 16 and over have received a first dose of vaccine and 91.1% have received 2 doses. For people aged 12 to 15 years, 80.6% have received a first dose and 73.4% are now fully vaccinated. In terms of deaths, sadly we're reporting the deaths of 2 men today. A man in his 70s died at Mercy Place Aged Care Facility in Albury, where he acquired his infection. He received 1 dose of COVID-19 vaccine and had underlying health conditions. There have been now 10 deaths linked to this outbreak at this facility. A man in his 70s from southwestern Sydney died at Liverpool Hospital. He had received 2 doses of COVID vaccine and had underlying health conditions. We'd like to express our sincere condolences to the families of these 2 men who have died. There are currently 210 people with COVID admitted to hospital in New South Wales, with 32 in intensive care, 16 of whom require ventilation. Of the people in intensive care, 24 are not vaccinated, 4 have received 1 dose of vaccine, and 4 have received 2 doses of vaccine. With people arriving from overseas now without requiring quarantine, it's important testing is done to make sure that we're keeping the community safe. So fully vaccinated international arrivals must comply with the New South Wales Health guidelines, including requirements relating to testing and restrictions on attending certain high-risk premises. They're required to have a COVID PCR test within 24 hours of arrival and also on or after day 7 after arrival. Children and those with medical contraindications to vaccine who are not fully vaccinated require similar tests and should have a further test on day 12 after arrival. Until a negative test is received on or after day 7, international arrivals are unable to enter high-risk settings such as aged care, disability care, healthcare and correctional facilities. So not following these guidelines not only puts your family, friends and community at risk, but also is a criminal offence and attracts heavy penalties. So please make sure you get tested and avoid those high-risk settings while you must. All travellers should also practice safe behaviours, so social distancing, wear a mask when indoors in public spaces, and practice good hand hygiene, especially in those first 7 days after arrival, and continue to be vigilant for symptoms of COVID-19 and immediately get tested with a PCR test at one of the clinics and isolate until you receive a negative result should you develop symptoms at any time. And we have high vaccination rates in New South Wales, but we all need to be vigilant to protect ourselves and our communities in New South Wales. If you haven't received a COVID vaccine yet and you're eligible, please don't delay. Even if you've had COVID, the disease and recovered, you should get vaccinated and make sure you've got your 2nd dose if it's now due and you haven't yet received it, and get a booster if you've had it's been 6 months since your 2nd dose. It's particularly important for children 12 to 15 years of age to get their vaccines as well, and so children can be vaccinated at your GP, pharmacy or one of the many state-run clinics. Anyone who's missed their 2nd dose appointment is urged to book into a New South Wales Health vaccine clinic or GP or pharmacy without delay. So now that we've reached the 90% double dose milestone, it's important that we focus on the booster program. People aged 18 years and over can get a Pfizer booster, and the booster shot will help maintain a high level of protection for you and in the general community against the Delta virus. But in this stage of the pandemic, it's important that we all be very careful with our COVID-safe behaviours. If you have symptoms at any time, please go and get a PCR test, not a rapid antigen test or RAT. get a PCR test from one of our clinics. This is they're more accurate in determining whether you've got an infection or not if you have symptoms. So again, thanks to everyone for coming forward, for getting vaccinated and getting tested if you have mild symptoms. Thanks a lot.